Okay, so what I wanted to show you today is a little bit of dentistry sort of work. Now, we always get asked, why do we need to give a dog an anaesthetic to clean their teeth? Now, there's the obvious, because we don't want to get bitten, because some dogs just don't tolerate things. This dog here is actually quite a lovely dog, but there's a couple of things that we can't really do without an anaesthetic. Now, number one is under the gum here. Although we get the calculus, we can actually clearly see. If you have a look where the probe goes, the probe actually goes down a couple of millimetres underneath the gum line, and we really can't give that a good clean if we don't get in there under anaesthetic. And that's actually where most of the disease and the damage actually occurs. So what's happening up here, although it looks pretty ugly and it smells pretty bad, the reality is that's not actually causing a lot of disease. It's what's happening at and below the gum line that gives us the biggest problem. The other thing we get, and we can just see it down on this tooth here, is the teeth obviously need cleaning on the inside surface of the mouth as well, so we can see the calculus build up on the inside of the mouth, and that's really hard to clean if we don't do this under anaesthetic. So this dog, you can see we've got mild gingivitis, so when we probe the gum here, we get a little bit of bleeding and it's a little bit red, but that's all perfectly reversible at this point. So this is really where we want to be doing the dentals. We don't want to be waiting until we get to the point where we've got a lot of gum loss, severe periodontal disease and needing to take teeth out with oral surgery. Really, we want to be intervening at this point so we get nice clean teeth and get things back to a healthy mouth. Okay, so this is what the teeth look like after they've been cleaned. So you can see much cleaner teeth. This is just the first side, so we'll need to flip the dog over obviously and do the other side. That gingivitis is going to resolve itself over the next few days now that we've removed the calculus and the bacteria that's causing it. There's no need for antibiotics or anything like that to settle it down. It settles itself down quite quickly once we sort out the underlying problem. So we'll do the other side and then wake the dog up, and that's job done.